In this video, I want to talk about how I use Sculptra. So Sculptra, in the generic term, is poly-L-lactic acid. It is a collagen stimulator. It builds volume. I don't like using it currently for building facial volume because I don't find it as reliable in terms of design. For me, I don't want something overfilled or underfilled. I use hyaluronic acid as my workhorse to design faces. So I really enjoy designing faces with hyaluronic acid over Sculptra. Philosophies change. I'm constantly open to new ideas, constantly open to new applications. Right now, where I use Sculptra almost exclusively is managing neck and chest wrinkles. So I find it currently more effective than even a laser. So that what I do is I inject it under the skin. I don't even use numbing cream. I've actually spent months designing this protocol so there's no pain and no need for numbing cream. Not no pain, but very minimal pain, using vibratory techniques and specialized longer subcutaneous needles that I can inject. So usually typically very minimal discomfort, very fast. I'm done injecting it in a couple of minutes. And what is it trying to treat? Is it treating the sagging neck? No. Look at facelift videos that I have. Look at my Botox for sagging neck videos to understand how I treat that. Is it for extra fat? No. It's specifically for that wrinkled look to the lower neck. And it's not going to get rid of everything. I believe that the cornerstone of treatment is really still a facelift or neck lift. But at the same time, for someone that just is coming in for a little touch-up, even after a facelift, they could still have some residual wrinkles. I believe, in my opinion, currently, Sculptra is bar none the best treatment to manage wrinkles in the lower half of the neck, or the whole neck, but usually it's that lower half where that shadow doesn't cover and you can sort of see that sagging skin. The other area that's a big concern for a lot of people is in the area of the chest area, like women between their breasts, if they're wearing a low-cut dress or a bra or a swimsuit, and they have that wrinkling, especially when they move their hands inward. Those vertical pleated wrinkles is an area where Sculptra works extremely well. After we treat it, we massage aggressively. You typically don't see an outcome for about 4 to 6 weeks. I typically recommend a few repeat treatments, between 2 to 3, to really optimize that improvement. So long as you know that we're not going to eliminate all the wrinkles, but we're going to improve areas, I think that's a very effective understanding. I've now, for at least, again, philosophies constantly change. I'm no longer massaging it for that week afterwards because there's some recent literature that in Dermatologic Surgery Journal that showed that there was no benefit in terms of massaging. The reason of massages is to get more equal distribution, so we massage afterwards, but I don't think you need to do it at home. And also what it does is to prevent nodules. If you do have 1 or 2 nodules that show up, occasionally I have a patient with a small little bump that shows up, aggregation of the product even after massage. Very easy to manage, takes me a second. I inject a little bit of what's called 5-FU and dilute steroid, and it really manages the situation pretty quickly. So in terms of recovery time, typically not bad. Most of my patients within a day or 2 are fine, but if you have bruising, it could last up to a week or longer. If you're a patient of mine getting this information through this video, please come in, let me laser it. I've got blue light, red light, different things that really mitigate and speed up that recovery very fast. So this is just a short video of Sculptra and how I use it, as I said, mainly for neck, décolleté, and chest. But hopefully that's a good video. But also, by the way, I've used it in my staff for stretch marks and loose arms. It's not quite as effective, but it still actually works pretty darn well for some types of stretch marks when the skin is loose and flaccid. So hopefully that's a good video for you.